This is the Forsyth County COVID update for July 14th. Over the last 14 days, we have stayed pretty steady, only a 2% increase in cases. You'll see those numbers in just a moment, staying in the 700s for cases per week. We had a deaths did increase 220%. Obviously, that number percentage-wise is large, or overall, we did report more deaths this week than last week. Thankfully, our numbers are still small, but we did report several deaths. I think it was 8 deaths this week. COVID hospitalizations, 30 Forsyth County residents are in the hospital. That is up from last week when we had 22 residents in the hospital. As far as the nation, the state and the nation across North Carolina, we saw 111% increase in cases and 138% increase in deaths, and then a 19% increase in hospitalizations. And across the whole nation, pretty flat, a 16% increase in cases, so pretty not much of an increase, and only an 11% increase in deaths. And hospitalizations, just like the state, are up 19%. So we're definitely seeing hospitalizations go up, deaths go up, depending on how you look at it. The percentage-wise has increased the most in North Carolina and in the county, and then the cases are going up, or at least staying at a relatively, compared to when you take out the Omicron surge, and even with Delta when that was in the 1,500 per week, we're a pretty good amount. And then obviously we don't know how many people are positive that are at home tests. So that's the one thing that we don't know about. So next, you can see this happened last Thursday. We reported last Friday. We were in the high category per the CDC's community levels. This changes every Thursday. Usually it's late Thursday evening, so we don't know what will happen this evening. As I told, I think Richard asked the question last week. I was really more surprised that we dropped from high to low the week before, and then we went back from low to high. This is based on hospitalizations, hospital capacity, number of cases. Again, tell people, wear a mask indoors if if you feel that you're at high risk. I'm going to a public health conference next week, and they're actually requiring that. So but the biggest thing I would tell people is to make sure they're up to date on their vaccine. I think that's the most important thing to do to protect yourselves, and obviously masks do offer protection as well.